We are back now with one of the most important steps we can take to fight the spread of coronavirus. But there's a lot of confusion about what social distancing really means. TJ Holmes is in Central Park with more, and TJ, medical professionals say you can still go outside, but you just have to be smart about it.
Yeah, straight what social distancing means, just give me my space, man. Just give me some space. But the confusion comes at a time we're being told to stay away from each other. Then why did I see that restaurant packed last night? And why are people still going to movies? Well, for those who are still trying to get out there, not wanting to social distance, well, some places are about to force you to do so.
6 feet. That's how far the CDC says you should stay apart from people to practice social distancing to stop the spread of COVID-19. But over the weekend, scenes like these at restaurants, stores, and on the street. Not much distancing. And we got mixed messages like this from California Congressman Devin Nunes.
If you're healthy, you and your family, it's a great time to just go out, go to a local restaurant. Yeah. Likely you can get in easily. Let's not hurt the working people in this country. Go to your local pub.
Now a crackdown. California, Ohio, New York City, Illinois, Washington, and Massachusetts ending dine-in service at restaurants and bars. Police cleared out New Orleans' iconic Bourbon Street as a new normal sets in.
I'm practicing as much social distancing as I possibly can. I don't go out.
The CDC hoping people limit activities outside the home to slow the spread. Shannon Unks, an American living in northern Italy, says she understands why the precautions are necessary.
We've tried to spend time doing things as a family, and it does get a little boring. But we've realized, after listening to pleas from medical staff who's been working, 22 hours a day, 7 days a week, the only thing that a person who's not a doctor or a nurse or, a fireman can do to help is that we can stay home. We can stay home and not get sick.
All right, you don't have to, of course, go out for some things. Yes, you have to go out and get food, but you don't have to go bowling. Think of it like that. And yes, for the idea of fresh air, it is good. A lot of people out here taking runs on their own, but you don't want to go outside and be at a picnic with 10 people necessarily, Stray. So think of it like that. Just stay away from people as much as you can.
You look like you picked a good spot to do that, TJ, this morning. Thank you so much for that. We're joined now from Washington by U.S. Surgeon General Dr. Jerome Adams. And Dr. Adams, the CDC just recommended that all events consisting of 50 people or more be canceled for at least the next 8 weeks. And on top of that, you have people going to businesses. Restaurants are still open in some places. Should we go to stores? What should we do? Or should we stay home and not go anywhere and not have any visitors? What is your recommendation?
Well, great questions. And first of all, I want to say thank you for that story on Donovan Mitchell, because it's important for people to understand that when we look at the South Korea data, 96% of people who actually had flu symptoms tested negative for COVID. So again, for most people, you're still going to be at low risk for getting it. And if you do get it, the South Korea data says 99% of people fully recovered. And so we want people to keep things in context, but we also want people to understand that, look, our numbers are where Italy's were about 2 weeks ago. Now's the time to really lean into mitigation strategies, social distancing, making sure you're washing your hands frequently. And what I would recommend to folks is what Tony Fauci said yesterday. Now is the time for us all to understand that we all have a role to play. Even if you are at low risk, you don't want to be the one to take coronavirus to your grandmother, to your pop, and cause them to end up getting what could be a fatal illness because they are at highest risk. And so we want people to lean into supporting local businesses in a way that allows social distancing. You saw in California, more people are encouraging carry out instead of going to restaurants. And as you mentioned, the CDC has said that we shouldn't have any large gatherings over 50 people for the next 8 weeks.
And you're a member of the Presidential Task Force, and we've been hearing the first vaccine is being tested on and that a new drug is being used in severely ill patients. So what can you tell us about that?
Well, those are pharmaceutical interventions. We don't expect the vaccine to be ready to roll out for at least a year. Important for people to know that a vaccine, if it's developed, will help us for the next round of coronavirus. The first round really is going to hinge on us leaning into hand washing, and social distancing. Remdesivir is a medication that people are experimenting with to treat coronavirus. And again, that looks promising thus far. But what's really going to get us through this are those tried and true public health measures that we've been talking about all along. And I think it's also important to note that yesterday there was a briefing at the White House where we helped America understand we really feel like we've turned the corner on testing. We're going to focus first on healthcare workers, the people who take care of the people, and also those at highest risk, people over 65 with symptoms. But we feel like over the next week, and I'm already hearing it, people in communities saying, I'm seeing testing now, I'm seeing more testing now, so that we can get a better handle on the number of cases in communities. But people still, whether you're positive, negative, whether you get a test or not, if you've got respiratory symptoms, you probably have an infectious disease of some sort. It's just as likely to be the flu as COVID, but you should stay at home.
So the thing we can do, social distancing and washing your hands. Dr. Adams, thank you so much for the helpful information. We appreciate your time. Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.